Last week, we started talking about suicide, but just like all things mental health, one conversation is likely not enough. So this week, we're going to go a little bit deeper into it, what it is not, and tips on how we can have real conversations about it. Let's get into it. Suicide is the act of self-harm with death as an outcome. Someone may attempt or complete these actions because they feel so overwhelmed by pain that they believe ending their life is the only way out. It's not just the final act, though. Suicidal ideation is when someone has thoughts about it, and suicidal planning is when they take steps toward that goal. For some people, there may be many steps or signs until that final act, while for others, one thought or action may lead to their death. So what is it not? Okay, myth number one, only depressed people die by suicide. As we've discussed before, depression doesn't have just one look. You might notice the signs in someone or you might not, but being depressed does not automatically mean someone will attempt suicide. And the opposite is true too. Everyone who dies by suicide is not depressed. In fact, a 2018 study showed that about half of those who completed suicide did not have a mental health diagnosis. Myth number two, talking about suicide makes things worse. Open conversations may actually reduce suicidal thoughts. In a 2014 review study, none found evidence to suggest that talking about suicide increased risk. For you, it may open an opportunity to express your feelings, seek treatment, and know that the people around you care. But how can we talk about suicide? The first step really is sharing your thoughts, feelings, and behaviors with people you trust. Talking about suicide isn't dangerous. Staying silent is. If you are the one in need, it's important for you to get help right away. Know that you are not a burden, and getting the help you need is important for you and to your loved ones. You may think that others will call you dramatic or that you're blowing things out of proportion, but did you know that the vast majority of family members actually want you to talk about your feelings? You won't get in trouble. And even if your life has to be disrupted because of this conversation, I really hope you'll welcome it. Sometimes when it's dark, it's hard to let the light come in, but ultimately, the light shines on our path ahead. Listen, that was a lot to take in today. So pause, take a breath. Remember, just by watching this, you've already taken a step toward understanding suicide for yourself and how to support others. It's heavy, I know, but it doesn't have to be the end of the story. If you or someone you know is struggling, talk to a trusted adult, reach out to a friend, or call 988. You can even text the Suicide Crisis Lifeline to get started. There's always someone ready to listen, and you deserve that support. Know that the world is better with you in it. I'm Dr. Ree in NYC. Till next week.